Standard precautions are the minimum infection prevention practices that apply to all patient care. Standard precautions include the following: hand hygiene, personal protective equipment or PPE, cough etiquette, sharp safety, sterile instruments and devices, clean and disinfect surfaces. Proper hand hygiene is one of the most important measures to prevent infections among team members and patients. Each team member is required to wash their hands for 20 seconds at minimum based on the following circumstances: before starting work shift, before and after a patient, before and after using gloves, after going to lunch or taking a break, after using the restroom, when they become contaminated, when hands are visibly soiled, after touching surfaces, doorknobs, remote controls, or the phone. When should hand sanitizers be used? Before and after treating each patient, before putting on gloves, and again immediately after removing gloves, after touching a patient or the patient's immediate environment. How should you clean your hands with sanitizer? Put the hand sanitizer on your hands and rub your hands together. Cover all surfaces until your hands feel dry. This process should take around 20 seconds. Thumbs, fingernails, and fingertips are most often missed by healthcare providers when using alcohol-based hand sanitizers. Nail care. Keeping nails short is imperative because most of the flora on the hands is under and around the fingernails. Long fingernails are likely to increase glove failure. Artificial fingernails or extenders have been the primary cause of multiple outbreaks involving fungal and bacterial infections in hospital intensive care units and hospital rooms. Chipped nail polish can harbor added bacteria that exist on freshly applied polish on short natural nails. Personal protective equipment. Wearing gloves, surgical masks, protective eyewear, and protective clothing is mandated by OSHA. Uniforms, scrubs, pants, and shirts are not intended to protect against a hazard and are not personal protective equipment. PPE is intended to protect the skin and mucous membranes of the eyes, nose, and mouth from exposure to blood and OPIM. What types of PPE are provided to team members? A lab coat or long sleeve shirt, masks, eyewear or shields, gloves, scrubs, and lab coats policies. As part of our infection control plan, all protective clothing, including scrubs and jackets, are kept in the office. Do not go home wearing scrubs. Bring extra clothing to change into at the end of the day. Scrubs are placed in the laundry bin at the end of each workday and cleaned weekly in the office. Mask policies. Remove the mask as soon as treatment is over. When removing a mask, handle it only by the elastic or cloth string ties. Never touch the mask itself. Replace mask when soiled and no masks around your neck. Protective eyewear policies. Protective eyewear or glasses with eye shields must always be used when seeing patients. Patients must also wear sunglasses during their appointment. Eyewear is located at each workstation. Disinfect eyewear between patients. Remove the eyewear by grabbing the strap and pulling upwards and away from the head. Do not touch the front of the face shield or goggles. Eyewear is not to be worn on your head. Glove policies. Wear appropriate gloves during all patient appointments. Do not use oil-based products before putting on gloves. Replace gloves if torn, punctured, contaminated, or if their ability to function as a barrier is compromised. Never wash or decontaminate gloves for reuse or before disposal. Ensure glove removal does not cause additional contamination of hands. Gloves can be removed using more than one technique: glove and glove or bird beak. Do not touch routers while wearing gloves. Order of how to put on PPE. Put on your disposable mask. Put on your protective eyewear. Clean your hands with hand sanitizer. Put on your gloves. Order of how to take off PPE. Remove your gloves. Clean hands with hand sanitizer. Remove your eyewear. Remove your face mask. Clean hands with hand sanitizer. Contaminated PPE policies. If a garment is penetrated by blood and other potentially infectious materials, the garment must be removed immediately. Extra scrubs are available in the office for team members should contamination occur. Team members may also keep an extra pair of scrubs in the office. Once scrubs have been contaminated, Complete one of the 3 optional solutions. Wash the clothes in the office, have a cleaning company pick them up, throw them away. Cough etiquette. A sign is posted at entrances with instructions to patients with symptoms of respiratory infection to cover their mouths or noses when coughing or sneezing. Use and dispose of tissues. Perform hand hygiene after hands have been in contact with respiratory secretions. General policies. Tissues and hand sanitizers are available throughout the office. Offer masks to coughing patients and other symptomatic persons when they enter the dental setting. Provide space and encourage persons with symptoms of respiratory infections to sit as far away from others as possible. If possible, place these patients in a separate area while waiting for care. Sharp safety. Occupational exposure to blood-borne pathogens from needle sticks and other sharps injuries is a serious problem. More than 1,000 healthcare workers in the hospital setting are injured with a needle or other sharp device every day. What are your chances of infection from a contaminated sharps injury? Hepatitis B, 1 in 5 if you're not vaccinated. Hepatitis C, 1 in 50. HIV, 1 in 300. Sharp safety includes the following. Organize your work area with appropriate sharps disposal containers within reach. Work in well-lit areas. Only use the one-handed scoop method. Avoid recapping needles. Plan safe handling and disposal before beginning procedures. Report all needle stick-related injury promptly. Tell the doctor about hazards from needles. Participate in required OSHA annual blood-borne pathogen training. Place used disposable syringes and needles, scalpel blades, and other sharp items in appropriate puncture-resistant containers. Keep fingers away from the opening of sharps containers. Remove burrs from disassembling the handpiece from the dental unit, restricting the use of fingers in tissue retraction or palpitation during suturing and administration of anesthesia, and minimizing potentially uncontrolled movements of instruments such as scalers or laboratory knives. Needle recapping instructions. One-handed scoop method. Place the cap on the bench top and hold the syringe in one hand. Keep the other hand by your side. Slide the needle into the cap, then lift it up and snap it on securely using only one hand.